Have you ever gotten lightheaded whenever you've been lying down and then stand up? What causes that? When you don't have enough blood that gets pumped to your brain, you can develop these symptoms, and it can even lead to passing out. Yet another connection between your heart and your brain. So to close out American Heart Month, I want to talk about a condition related to this phenomenon. Many of you, particularly if you're in healthcare, have probably heard of it. It's called POTS, P-O-T-S, which stands for Postural Orthostatic Tachycardia Syndrome. It affects approximately 1 to 3 million Americans. It's most commonly seen in young women who often get gaslit for these symptoms. And that's exactly why it's critically important for us to talk about this to raise awareness of how common it actually is. Yesterday, I presented the case of a 32-year-old woman who presented to her primary care doctor with symptoms related to dizziness and lightheadedness, particularly when she went from a lying position to a standing position. Now, she's had these symptoms for a number of years, and she's seen other doctors for it, and she's had a variety of laboratory studies that have been worked up, as well as MRI imaging, and they were all reportedly normal. But the symptoms are just getting worse, and she's tired of not having answers. I mentioned in the case presentation that her baseline heart rate lying down was 90 beats per minute, but after she went to standing position, it went to 122 beats per minute, and her blood pressure never changed. So I'm going to give you a little detailed explanation of her diagnosis, which is POTS, or Postural Orthostatic Tachycardia Syndrome. It's a form of dysautonomia, which is where the autonomic nervous system in our body isn't regulating quite right. What's the autonomic nervous system? It's the way our nervous system regulates involuntary body functions. That means the way our body manages things that we're not consciously thinking about, like our heart rate, our blood pressure, our digestive system, and even our breathing. So if our control center for all of these things that are supposed to be happening without our knowledge isn't working right, it can cause a variety of different symptoms. To best explain this, you need to understand what happens to your body when you go from a lying to a standing position. Think of it like this. You have a certain amount of blood in your body at any given time, and your heart is pumping blood to all different parts of our body. And right now in the lying down position, gravity is not fighting against us because the heart and the brain are in the same plane as well as the legs. Okay, I'm not an artist, so do not judge me, but what I've done is on a Ziploc bag, I have drawn a brain, the heart, the arms, and the legs, and this represents the circulatory system and how they're all communicating. Now, what I've also done with the Ziploc bag is I put water inside of it. So here we go. If the person is lying down, you can see that all the water is getting from the brain, heart, legs, everything is good. But then if the person goes to standing up, all of a sudden the water level drops and it's all pulling below the heart and nothing is getting to the brain. It's kind of like what happens in our body. When we go from lying to standing, we will get blood that gravitationally, gravity pulls it to go into our legs. But we have something in our blood vessels called the autonomic nervous system that'll squeeze the blood vessels tighter so then blood can get to your heart and your brain. So let's use this example. If we go from standing and then our blood vessels squeeze, you can see where the blood will then get to the brain. Follow me here because it's going to start making sense in just a minute. If our nerves that are supplying the arteries fire at a high rate, you will see that you'll get vasoconstriction, or where the blood vessels will start to squeeze down. But if you get decreased sympathetic firing, you'll get vasodilation, where the blood vessels do not squeeze down. And that means the blood will not be able to squeeze. This is what happens in vasodilation and then in vasoconstriction. Make sense? But in POTS, the blood vessels don't really have that autonomic control like it should. So when you go from a lying position to a standing position, they don't react as quickly to get that fluid to the brain. So the heart responds by beating faster to try to push that fluid to the brain. Hopefully that makes sense. In POTS disease, when the blood vessels aren't constricting, your heart responds by beating faster to try to pump more blood to the brain. And that's where the tachycardia comes in, or rapid heart rate. POTS is just not one type of disease because there's many different variations. There's hypovolemic POTS, where basically your body's blood volume is decreased. Neuropathic POTS, where these small little autonomic nerves just aren't working quite right. And then there's hyperadrenergic POTS, where your sympathetic nervous system fires too much. Basically, there's too much adrenaline pumping in your body. There's even POTS disease that can be related to certain autoimmune conditions like lupus or Sjögren's syndrome, even post-COVID POTS. Mast cell activation syndrome, or MCAS, can also be related to POTS. There's also a high correlation of people with hypermobile Ehlers-Danlos syndrome, or HEADS, with POTS disease. In fact, almost 80% of people with HEADS will have some form of POTS. And conversely, up to 31% of people with POTS will have HEADS. Because it affects the autonomic nervous system, and there are many different roles of the autonomic nervous system, patients can present with a variety of different complaints and symptoms. Cardiovascular symptoms include rapid heart rate, like we talked about earlier, dizziness, and syncopal episodes. The dizziness and syncope, or passing out, is related to decreased blood flow to the brain. If you don't get enough blood that goes to your brain, you can black out. Neurological symptoms of POTS can be fatigue, brain fog, and migraines. Symptoms related to autonomic dysfunction can include temperature intolerance, like you may not be able to tolerate extreme hot or cold weather, including too much or not enough sweating. The autonomic nervous system also controls your digestive system. So if the nerves to your gut isn't working right, you can have nausea, bloating, constipation, or diarrhea. The symptoms in some people may not be severe, but then there are certain things that can make it worse. Like if you get sick and you're dehydrated, or if you're on your period, the hormone fluctuations can all make POTS worse. So how do we diagnose POTS? Of course, we do a detailed history and physical examination, and most importantly, we want to check the heart rate and blood pressure from a lying to standing position. The blood pressure going from lying to standing should not have much variation, but the heart rate, if it increases by 30 beats per minute, is pretty concerning for potentially having POTS. Of course, your doctor should order routine laboratory tests such as checking your thyroid and B12 levels to rule out other potential causes of these type of symptoms. Other blood tests can help rule out other responsible autoimmune conditions such as lupus. An EKG should be checked, including a 24-hour Holter monitor to rule out some type of other arrhythmia, and a tilt table test is usually ordered to help make the diagnosis. This is a test where they put your body in a variety of different positions and check your heart rate and blood pressure, and this is usually done in patients that are having dizziness and syncopal or fainting episodes. Checking plasma norepinephrine levels in case there is concern for hyperadrenergic POTS, and doing a skin biopsy in cases of suspected neuropathic POTS. Once it's diagnosed, well, how do we treat it? There is no cure for POTS, and the treatment really is individualized to help manage the symptoms. Non-medication type treatments include staying hydrated and increasing your salt intake so your blood volume expands. You hear me preach on this all the time. Compression socks. I wear them all the time because I am standing all day in the operating room, but for people with POTS, compression hose can help reduce the blood venous pooling in your legs, so it will help treat your symptoms. Everybody should be wearing compression socks. So if we're using our bag explanation, staying hydrated is obviously going to put more water into your bag, and compression socks will help squeeze the water back up to your brain. Exercise is really important. So what type of exercise can you do? Now you want to minimize the gravitational forces on your body. So you want to do things in the recumbent position like rowing, swimming, or recumbent bike. So not things like running and jumping. Leg exercises and strengthening is really important because, again, you don't want to have a lot of venous pooling or fluid pooling in your legs. So working those muscles will help push that blood flow back up to the heart. Really work those calves. And I'm definitely going to stick a note in to really promote core exercise strengthening because it's great for POTS and it's great for your spine. Here's a tip that you may not have thought about. Small, frequent meals. When you eat a big meal, all the blood flow will rush to your intestines. That's taking away blood flow to your brain. So if you eat small, frequent meals, you're less likely to have that post-meal hypotension. Depending on what type of POTS you have, your doctor may recommend certain types of medications, including midodrine, which helps increase your blood pressure, or beta blockers, which will help reduce your heart rate. And the biggest thing that I want to stress with this educational session on POTS is that it is not a rare condition, and it is often misdiagnosed. It can cause a lot of weird symptoms in young women who are often gaslit by the medical profession. So by being aware and identifying and diagnosing this condition is critical to these patients and their long-term health. And that means physical and mental health. Our patient was diagnosed with POTS disease and began her symptomatic management and is doing much better. And mentally better, because now she knows why she's having these symptoms and that she's not crazy. Another case of patient-focused and compassionate care. Stay tuned next week and we'll go through another case.